Good morning, everyone. I'm excited to welcome you all today. We will be exploring the important topic of vital signs and infection control. This is part of our clinical practice for first-year BSc nursing, following the KUHS syllabus. In this presentation, we will cover the fundamentals of checking vital signs and the best practices for infection control to ensure patient safety. Let's get started and make this session both informative and engaging. Let's take a closer look at vital signs and why they are so important. Essentially, vital signs are key indicators of a patient's physiological status. They give us a quick snapshot of how well the body is functioning at any given moment. The main vital signs we focus on include temperature, pulse, respiration, blood pressure, and oxygen saturation. Each of these provides valuable information about different aspects of health. Regular monitoring of these signs is crucial because it helps us detect any changes in a patient's condition early on. This way, we can intervene promptly if something is off. Additionally, tracking vital signs over time allows us to evaluate how well a treatment is working. Overall, understanding and monitoring vital signs is fundamental to providing effective patient care, aligning perfectly with our goal of ensuring the best possible health outcomes. Let's talk about temperature measurement, which is a key part of assessing a patient's health. We typically use methods like oral, tympanic, or axillary measurements. Each of these methods has its own advantages and specific procedures. The normal body temperature range is generally between 36.5 degrees C and 37.5 degrees C, so knowing this helps us identify when a patient might have a fever or hypothermia. To measure temperature accurately, we rely on equipment such as clinical thermometers or digital thermometers. It's really important to record and report any abnormal findings promptly, as this can provide critical information for diagnosis and treatment. Additionally, we must always ensure proper infection control during temperature measurement. This means following strict hygiene practices to prevent the spread of infections. By doing so, we protect both ourselves and our patients while maintaining high standards of care. This step is essential in the overall process of monitoring and maintaining patient health. Now let's talk about pulse measurement. There are two main types we commonly assess: apical and peripheral. Peripheral pulses include radial, brachial, and other sites. When measuring the pulse, we're looking at a few key factors. First is the rate, which for adults typically ranges from 60 to 100 beats per minute. Next, we evaluate the rhythm, whether it's regular or irregular, and the volume, which tells us the strength of the pulse. It's important to report any deviations from the normal, such as tachycardia, which is a rapid heartbeat, or bradycardia, which is a slower than normal heartbeat. These assessments help us understand the patient's cardiovascular status and are essential for providing comprehensive care. Remember, consistent and accurate pulse measurements are a cornerstone of vital sign assessment and overall patient monitoring. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about respiration. The normal breathing rate for an adult is typically between 12 and 20 breaths per minute. It's important to observe not just the number of breaths, but also the rhythm, depth, and character of each breath. These details can tell us a lot about a patient's respiratory status. Pay close attention to any abnormal breathing patterns, such as dyspnea, which is difficulty breathing, apnea, which is a temporary or complete absence of breathing, or tachypnea, which is an increased rate of breathing. Recognizing these signs early is crucial in providing the right care. So, as we assess respiration, remember to keep a comprehensive view: rate, rhythm, depth, and character, to get the full picture of a patient's respiratory health and identify any issues that may need immediate attention. Let's talk about blood pressure and pulse oximetry. First, blood pressure is measured in terms of systolic over diastolic pressure, with the normal range being around 120 over 80 millimeters of mercury. It's a vital sign that helps us assess how well the heart is pumping and the condition of the blood vessels. To measure blood pressure accurately, we use a sphygmomanometer along with a stethoscope. These tools allow us to listen to the blood flow and determine the pressure readings. Next, we have pulse oximetry, which measures the oxygen saturation level in the blood, known as SpO2. A normal SpO2 level is typically between 95 and 100%. Monitoring oxygen saturation is crucial because it tells us how effectively oxygen is being transported to the body's tissues. If you notice any deviations from these normal values, whether blood pressure is too high or too low, or SpO2 drops below 95%, it's important to report these changes immediately. Prompt action can be critical, especially in clinical settings. These measurements are fundamental components of patient assessment and tie into the overall goal of ensuring patient stability and safety. Today, I want to talk about blood pressure measurement. Blood pressure is a vital sign that gives us important information about how well the heart and blood vessels are functioning. Proper measurement is crucial because it helps us detect conditions like hypertension early on. When measuring blood pressure, we typically use a sphygmomanometer and a stethoscope or an automatic device. It's important to ensure the patient is seated comfortably, with their back supported and feet flat on the floor. The arm should be at heart level, and the cuff should be snug but not too tight. We usually inflate the cuff until the pulse is no longer felt, then slowly deflate it while listening for the sounds of blood flow. The first sound we hear corresponds to the systolic pressure, which is the pressure when the heart contracts. The point at which the sounds disappear marks the diastolic pressure, indicating when the heart relaxes. Accurate blood pressure readings are essential for making informed clinical decisions. They connect directly to our overall goal of maintaining cardiovascular health and preventing complications. So, always ensure proper technique and consistency in measurement to get reliable results. This slide doesn't contain enough information. That's why we're moving to the next slide. When documenting vital signs, it's essential to record your findings accurately on the graphic sheet. This helps ensure clear communication among the healthcare team. Remember to use standard symbols and units to avoid any confusion or misinterpretation. Be sure to note the time and site where the measurements were taken, as well as any nursing actions you performed, like repositioning the patient or applying a cold compress. Reporting critical values promptly is crucial because these can indicate urgent issues that need immediate attention. By following these steps, we maintain accuracy and safety in patient care, which ties into our overall goal of providing high-quality, reliable nursing practice. Now, let's talk about cold applications and their role in patient care. The main purpose of applying cold is to reduce the temperature of an area, which can help relieve pain and also control bleeding. This makes cold therapy a valuable tool in managing injuries and certain medical conditions. There are different types of cold applications we might use. A cold compress is a common option. It's simple and effective for localized pain or swelling. An ice cap is often used in cases involving head injuries or migraines. Tepid sponging, which involves using lukewarm water, can help in broader situations like fever reduction. When applying cold, it's crucial to take some precautions. For instance, never place the cold source directly on the skin to avoid frostbite or skin damage. Always use a barrier like a cloth or towel. Also, keep an eye on the patient's comfort. If they feel too uncomfortable or start to experience adverse effects, remove the cold immediately. Connecting this to the overall theme, using cold therapy carefully and correctly can significantly improve patient comfort and outcomes. It's about balancing effectiveness with safety, ensuring we provide relief without causing harm. Now, let's talk about the care of equipment. It's really important to remember that after each use, you should thoroughly clean and disinfect the equipment. This helps prevent the spread of infections and keeps everything safe for both patients and staff. Handle the equipment with care to avoid any damage, which can compromise its accuracy and longevity. When storing the equipment, make sure it's kept in a clean, dry area. This protects it from dust, moisture, and other potential hazards. The key pieces of equipment we're focusing on include the thermometer, blood pressure apparatus, stethoscope, and pulse oximeter. Each of these tools plays a vital role in patient assessment, so taking good care of them ensures they function correctly and provide reliable readings. Proper maintenance of our equipment isn't just about cleanliness, It's about ensuring accurate results and safe, effective patient care. Remember, good equipment care is a fundamental part of our overall commitment to quality healthcare. Infection control in clinical settings is absolutely essential for patient safety and for protecting ourselves as healthcare professionals. First, maintaining aseptic technique during all procedures is crucial. This means we need to be very careful to prevent any contamination, ensuring that our environment and tools stay sterile throughout the process. Next, practicing proper hand hygiene before and after patient contact is one of the most effective ways to stop the spread of infections. Hand washing or using alcohol-based hand sanitizer helps eliminate germs before they can transfer between patients or surfaces. Using personal protective equipment, or PPE, such as gloves, masks, and gowns, appropriately is also vital. PPE acts as a barrier, reducing the risk of transmission of infectious agents between patients and staff. Remember, it's important to use the right PPE for each situation and to put it on and take it off correctly. Lastly, disposing of waste properly according to infection control policies is a key step. Proper waste management prevents the spread of pathogens and keeps the environment safe for everyone. All these practices are interconnected and form the foundation of effective infection control, which ultimately safeguards both our patients and ourselves in any clinical setting. Let's talk about hand hygiene and PPE, which are crucial for infection control. When it comes to hand hygiene, you can use soap and water or an alcohol-based rub, depending on the situation. It's important to remember the 5 moments of hand hygiene: before and after patient contact, after touching surfaces, and so on, to prevent the spread of germs. Now, regarding PPE or personal protective equipment, you should always use it based on the level of risk involved. This includes gloves, masks, goggles, and gowns. The goal here is to protect both yourself and the patient. By following proper hand hygiene and PPE protocols, we significantly reduce the risk of cross-infection. Ultimately, this helps us ensure patient safety and maintain a safe healthcare environment for everyone. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide.